Right. Good afternoon, everyone.
Well, she couldn't get the rest of her hours driving.
Right. So welcome. My name is Lindsay Petrini, for those of you that I have not met, and I am with Wellstar North Fulton Hospital, but also am proud to serve as the chair, 2021 chairman of the Greater North Fulton Chamber of Commerce this year. And I'd like to welcome you to the January Chairman's Circle Executive event. And I just want to say thank you to all of the organizations on the phone that have chosen to be a Chairman's Circle member. Besides the benefits that you get as a Chairman's Circle member, the commitment to the Chamber and the commitment to the community is extremely important. And during times like this, where we're all making decisions on where to invest and where to maybe back off because of the challenges that we face with the pandemic, we thank you for your investment and trust in the Chamber, and continue to want to support you as our Chairman's Circle members in the upcoming year. So this is our first executive event for the year, and so many to come. So I'm going to remind us, which I feel like by now everyone should have a good understanding of their Teams or Zoom etiquette, but let me just remind you to please keep your microphone on mute so we can avoid background noise during the presentation. If you have any questions, we have that fun little chat feature. We'll address those at the end of the presentation and get on and be able to answer as many questions as possible. I'd first like to introduce our sponsor for today, which is HLB Collins, which is one of Atlanta's most well-known CPA and consulting firms. For over 50 years, they have worked to help businesses and individuals increase profitability. Their industry specialists provide unique insight and expertise. HLB Gross Collins recognizes that the needs of clients in one industry are vastly different from the needs of another, and to adhere to the mission, they are dedicated to providing targeted expertise through their client service and principal approach. The businesses they serve benefit from in-depth knowledge of the industry-specific challenges and opportunities they face locally, nationally, and globally. I'd like to welcome Laura Matajewski. Thank you for sponsoring today's program, and would like for you to say a few words on behalf of HLB Gross Collins.
Wonderful. Thank you so much, Lindsay. Good morning, everybody. We are honored to be here today, this first event of the new year. Hard to believe it's already 2021. HLB Gross Collins has been involved with the Greater North Fulton Chamber of Commerce for many years now, and are dedicated partners through the Chairman's Circle with many of you on today. I see a lot of friendly faces. Through our dedication and support through this past very strange pandemic year, as we continue onward and move forward, our COVID-19 efforts continue to push us forward in providing the support and dedication that we've become well known for. And we look forward to hearing what the Wellstar team has to share today. And I hope to continue to get to know each and every one of you, and certainly reach out as we continue to progress throughout the year, and we would be happy to be a resource for you. Thank you again for the opportunity, Callie Boatwright, Lindsay, and the entire Greater North Fulton Chamber.
All right, thank you, Laura. At this point, I'd like to go ahead and introduce our keynote presenter today. And I was just looking at the brief bio that was given to me about Snehal Doshi, who is our Senior Vice President of Ancillary and Support Services. And I have to say that, as I know Doshi very well, it is humble, because his background is quite extensive, and his work with our pharmacy teams over the years has been really a huge investment and commitment to our organization. So I'm really delighted to be able to introduce him today. As I mentioned, he was recently promoted to the Senior Vice President of Ancillary and Support Services. Before that, he was Vice President of Pharmacy Services, and then later took on the lab during a very challenging time where COVID-19, because as a hospital operator knows, vaccinations come through the pharmacy and testing comes through the lab. So he had, from a system standpoint, stood up both of those efforts for us. And so to have him be able to take the time to present today is really a huge opportunity for everyone. It says here, as I told him earlier, it says Dr. Doshi, that I need to thank him for being here, but for anyone that is within the Wellstar family knows, he's just Doshi. And so Doshi, take it away for us, and thank you for being here.
Yeah, I appreciate it. Thank you for having me. So let's give me 1 second here. I'll share my screen. Okay, Lindsay, does this look okay?
Yes, it looks great.
Okay, perfect. So thank you for that introduction. You know, through lab and pharmacy, I get to play now with other ambulatory services in our health system with support from folks like Lindsay, who I've learned quite a bit from over the last few years that we've worked together. So if anybody was envying my position with blood and drugs here at Wellstar, it's not as fancy as it sounds with blood and drugs, but that's what they call me here, Doshi, the guy that kind of runs blood and drugs. I guess I can transition to the street someday too. So anyways, I'm here today to kind of explain or just go over the COVID vaccination process in partnership with the state. As one of Georgia's largest health system, we have been allocated quite significantly, and we have a responsibility to the community to rapidly immunize in a safe and effective manner. So just because we have such a large access. And I'll go through the different variations of what's in the market, what you should expect. You know, this vaccination program for COVID runs really deep. So I'll take the questions in the chat box and chat function, and we'll coordinate that as we go along. But I hope that I've covered most of the topics by the end of the last slide. So what the purpose of our vaccination, or why our participation, is to provide the COVID-19 vaccine to the high-risk populations and eventually to everyone in Georgia. So access, safety, efficiency in the transport, and rapid access is perhaps going to be the most important as we move along. So the CDC and the DPH worked together, and they came up with a recommendation on how the phases. We can't obviously just have general populations just getting immediately vaccinated. So for that reason, this is complex, but I just wanted to show that there was a plan, and this phase 1, phase 2, and who qualifies in phase 1, who falls under phase 2, is also constantly evolving. And on the next slide, I'll explain how. But there was some structure. Everybody tried to come up with, hey, if you're frontline healthcare worker because of COVID, that's where most of the burden has been at the moment. So if we vaccinate them, they can then take care of our COVID patients. The elderly, other immunocompromised patients, anybody else at risk, first line, I guess our responders as well, so fire, police, so on. And then the phase 2 becoming teachers and other essential workers for us, and then phase 3 and phase 4, and then it's just phase 4 onwards is just more routine vaccination as we get more data as to how vaccines series are supposed to work and so on. So where we are today. So we're in phase 1A plus. So that plus is new. So we started with phase 1A. Everybody quickly realized that we need to vaccinate more. The vaccine supply is pretty healthy in our country, so we started to try to push out more. So what is phase 1A plus on top of our frontline workers? So it'll include our healthcare workers, right? EMS, physicians, nurses, our COVID testers, our long-term care staff and residents, and then anybody over the age of 65. So in the original plan, it was you've had to have an underlying clinical condition to justify. So within 65 and older, there were rules, but not anymore. Also includes law enforcement and fire personnel, volunteers, 911 operators, and so on. So that's the system. That's our community structure. That's how we're going to go with phase 1A+. That is the phase we are in today. So if you're 65 and older and a WellStar established primary care patient, you should have already received notification to get your COVID shot and schedule it across the 12 locations that we have and schedule through MyChart. Now, the question also comes up, you know, we're not the only ones immunizing here in the state. So you have county clinics. I'm sure our peers, Emory, Northside, Piedmont, you know, the other health systems, everyone's trying to do their part as well. If we go onto the DPH website and COVID-19 vaccine, you can search by county where a vaccine is available for you. You meaning, I don't want to go to WellStar, I just want to walk in somewhere else and schedule and get my shot immediately. Maybe I was not able to get on the schedule at WellStar, so I want to just walk in and get my vaccination. So for that reason, DPH is continuing to upload and update their website to show you where and how you can schedule your COVID shot. Okay, and then phase 1A+ will eventually roll into phase 1B. We are unsure when phase 1B will open up. Yesterday, you may have heard that the HHS is going to just release all the vaccine, not hold back for second doses. We hope that that will accelerate phase 1B, but it's really important that everybody moves together, meaning if we are the administrators of the vaccine, everybody, Piedmont's, Emory's, other health institutions, other outlets, other ambulatory locations, we all work together, or else what's going to happen is WellStar may be stuck still immunizing our 65 and older population when we've moved on to phase 1C at other sites, and then there'll be an equity discrepancy across our communities. And those that are at risk need to go first. So that's where the priorities are going to lie. That's where all the infrastructure resources are being pushed towards. And we are bound by an agreement that says we will we'll move in lockstep and get direction from the state when we can move in. If I was a guessing person and leave up to chance, I'm thinking phase 1B will open up in February, first week of February. But that also depends on how we perform in these upcoming days at the rate of vaccination. I'll tell you, WellStar, through Lindsay's team here, is vaccinating north of 2,000–3,000 patients a day. We're trying our best. Also have to understand that the hospitals are full right now with COVID, staffing issues, and everything that goes in. So we're trying our best to repurpose staff, hire new staff, contract staff, throwing whatever we can at this so we can immunize as many as we can. So I'll get into more structure and stuff in a little bit, but this is how the phasing works. This is how 1B, 1C, and we're looking forward to these, to when this vaccine becomes routine. All right, our status today. So initially in the news, it was, oh, Georgia may or may not receive vaccine. How much are we going to receive? This is public knowledge. It's on the websites. We all publish this every day, that we have administered so far in the state of Georgia close to 250,000 vaccines. So that is everybody. So everybody that qualified in the phase 1 and 1A+ group that we just discussed. Okay. So the Pfizer and Moderna, I'm going to get into that in a second. But if you look at our allocations here, the Pfizer allocation and the Moderna allocation, so that's getting you close to 1 million shots. And I'll get to what's in the pipeline and how we're going to play here. But out of the million allocated, we've been shipped close to full shipment. And if not in the next few weeks, we will receive full shipments. But we are having a difficult time opening up access and administering these vaccines. And when I say we, as in the state of Georgia and everybody, all the other states. But this is where we stand today. When it says enrolled providers, the 1,575 are enrolled sites per se, locations to administer the vaccine. So to provide you an example, WellStar has today, we have 25 locations administering the vaccine. So we would be 25 out of the 1,575, to provide some perspective here. All right. So this is how it plays out into what's an essential worker, who qualifies for that, who qualifies for people. How do I know? Am I increased risk of severe COVID-19 illness? So these are the definitions of the different phases, and we'll make sure that the slides are made available to you as well, so that you understand who falls into what bucket. As we get into, so for example, let's play a little. So in the green slot here, people at increased risk of acquiring or transmitting COVID-19. So you have people attending college and universities that fall into this, but that would be phase 1C for us. So we're not there yet. The yellow box for us, people at increased risk of severe COVID illness. These are 65 and older we talked about. They're already in the phase 1A plus. So that's how the phases are going to move. That's how we've tried to, you can't put everybody in a bucket. Some are shared buckets, but we try to, we as in the state and CDC and everyone, try to come up with definitions on input onto how this is going to continue to roll. Okay, so how does a vaccine release actually work? So initially when, that's the first quadrant here, is that when the vaccine was made available, you can't just shoot out 1 million doses to 50 states. So for that reason, we felt that the supply is going to be constrained. We opened up a very narrow schedule of who can actually get immunized, but we are making great progress. So I would say we're not moving into the second quadrant here where the red line is, where HHS has, manufacturing is looking great, and HHS is going to push out basically every vaccine that they have and not hold on to stockpiles or hoarding or second doses and so on. So as that opens up, scheduling opens up. Scheduling opens up, that means we're administering more. When we administer more, the need over time is slowly going to decrease. And Economics 101 will tell me that at that point we will have additional, more supply than there is demand, and then, hopefully COVID vaccine will just become routine process as we do today with pneumonia or Tdap or MMR. They're just routine vaccinations. Nobody hears about, except for flu clinics, because it's seasonal. Nobody really hears about vaccine clinics when it comes to MMRs and stuff, right? It's just routine. You go to your primary care, you get the shot, it's your time, we move on. So I'm not quite sure what the future holds, but that third quadrant is supposed to be that. Okay. All right, so these are the vaccine candidates. I should have had a disclosure here, as our legal team says. I am not endorsing one. Do not leave this meeting and start investing in their stock. I'm not quite sure which one's going to work out here. Anyways, but this is our pipeline, okay? So these are the United States companies, or that's something that's perhaps being developed here that would be made available to us, okay? So the first two, which is Moderna and Pfizer, are already here. This is what we are administering today. Okay. AstraZeneca and Oxford worked on it. They got their approval. So the United Kingdom has already started using this vaccine. And we are waiting for Johnson & Johnson. They actually own Janssen. So J&J, Novavax, Sanofi, Glaxo, they're coming up with their versions as well. You'll see the platform is the technology that they use, and I'll go into mRNA for a second just so that I can kind of go over some fact checking here. I've heard some stories, and I just want to make sure that we're, if you are still debating if you should get the vaccine or not, hopefully we can shed some light into that. Okay. But if you look at the age groups, there's not enough data to say get vaccinated if you're under 16 years old. So our peds population is going to hold off on it for the moment. Most of the vaccines will require 2 doses. So there's an initial shot, and then X days later, you get your second shot. The storage and handling I'll go over today is perhaps more the fun logistics part of this as to why we have access issues, and I'll go over that in a few. But obviously, vaccines need to be stored a certain way. This is going to be no different. Okay, so the platform you're seeing here is, Moderna and Pfizer using the mRNA. That doesn't mean that it actually has the virus. It's not a dead virus. It's not a live virus. It's a synthetic portion, and I'll get over that in a second. Okay, the vaccine is administered for the most part. Everybody here, except for one, Johnson & Johnson, has not released how to administer the vaccine, meaning do you give it subcutaneous, do you give it intramuscular, so on. Okay, but for the most part, vaccines we play with are intramuscular. Okay, so this is an example. This is Pfizer. This is how we receive the Pfizer vaccine. The Pfizer vaccine comes in a multi-dose vial. This is the vial. It comes in packs of 195 vials. So that we call them pizza boxes because that's how they're shaped. So they come in 195 vials in a pizza box. Each vial can yield 5 doses. So each pizza box is going to give you close to 1,000 doses. And I say close to because, being a pharmacist myself, I'll tell you, we try to maximize anything we can. Any drug, appropriate use and everything is extremely important for us. So instead of 5 doses, we are getting 6 doses in some cases. And that's deliberate. That's not because it's, more diluted or anything like that. Because of that emergency cushion, Pfizer has allowed that. But there's a technique on how to draw out the 6th dose. So training, your needle size when you're diluting, there's a lot of factors that go into it. But as a minimum, we should be getting 5 doses per vial. Wellstar has been getting around close to 6 right now, so we're fortunate we're just moving on using that technique to administer. Pfizer vaccine has to be frozen, and when I say frozen, negative 80 degrees centigrade. So ultra cold. So during shipment, FedEx is the shipper and UPS is the shipper for these. The packaging includes dry ice. It comes with multiple layers. They have remote monitoring in there. And then once it's received, we do the same thing. So Wellstar is fortunate that, we obviously had insight that this is coming. This is what the requirements are going to be. We do have some ultra cold freezers today. We use them for bone tissue, other activities. So we went ahead and purchased many more freezers. And we're deploying them as they come in. So the whole nation started ordering ultra cold freezers. And these freezers are like $50,000 a freezer. If we have 20 locations, Wellstar had to invest quite a bit of capital to make sure that we get into this business because Pfizer was the first vaccine that was approved. So this is how Pfizer works out. When we as the clinical team, when we receive the vaccine, Pfizer is also unique in the sense that this is concentrated vaccine. We have to dilute the vaccine. So that's one step number. So store it, step number 1. Step number 2, dilute. Step number 3, draw the 5 doses out of the vial. So that's step number 3, and then administer. So it is a time-consuming process. So it's not something where I would recommend at the moment where you just have drive-throughs, where drive up in a tent in your car, I administer the vaccine, you move on kind of thing. It's just a very complex because of the storage and the dilution and everything required for this. And that's also created some access issues for everybody as we all try to learn how to play with the vaccine. All right, so how do RNA vaccines work? This is our world. I told you it's a synthetic version of the virus's genetic code. So when that gets administered intramuscularly into your body, it triggers a response from your body to create a protein. And that's going to go ahead and then create the antibodies and the T cells that are going to be required to fight the virus. So what does a vaccine not do? Okay, so it doesn't prevent you from getting COVID. It's not 100%, hey, you will never get COVID. Take the vaccine and you can just go around, not wear a mask or not wash your hands or not practice proper social distancing. So it does not do that. But just like the flu shot, if you do get the virus introduced, your body will be ready to fight it. So maybe you will have decreased symptoms, maybe you'll have decreased illness, so on and so forth. But it doesn't magically just put up a shield where I'm unable to get the COVID virus now. That's not how the vaccine is built. That's not how it works. We don't have vaccines for that. So this is just so to get your body ready so that the next time that you are exposed to the virus, your body is ready, it's already developed the antibodies, and we move on. And that's where the second dose comes in. So data, I'll give you an example. If you were concerned that we do not have enough data to push the vaccine, I'll tell you that pneumonia vaccine today is mainstream for everybody over the age of 60 today. When that vaccine first came out, the clinical trials had 4,000 enrolling participants in, and it is mainstream today. The COVID vaccine has had 40,000 enrollments, and it's 90% effective. So the data shows that, and I have received mine, and the data shows that the vaccine does work, and you should get it. And there is a science behind it. And mRNA technology is not new. So although the vaccine got developed in a year, the technology has been worked on for decades. So it was just more honing in. Coronavirus is not new. This particular strain may be different this time around, but coronaviruses are not new. We've been testing on them. We've been learning about them, building the vaccine technology for years on this. So for that reason, a 1-year turnaround on this, we just cut the red tape for all the approvals that go into it. So the vaccine is effective. The mRNA is what Moderna and Pfizer use for their vaccines today. The others are going to use different kind of technologies. All right, so what do you have to do to get enrolled as a provider to give the vaccine? So if you're a clinician today on the call and you want to enroll your location, you have to have a contract with the CDC through the DPH. There's training, terms and conditions, enrollment, volume, so on and so forth that goes into it. You have to demonstrate competency in holding and storage, distribution, and administration of the vaccine. You have to show that you have the infrastructure, including the ultra-cold freezers and everything that go with it, to manage the vaccine, and that you serve today a population that will be in the phase 1A, B kind of groups. So that is enrollment. And then how are you going to show your data? How are you going to share it? That all has to be established. So this activity should have happened months prior to the vaccine coming. So if you are interested, basically we have to follow these steps. So when we signed up for it before the vaccines came through, these were the expectations that we were actually going in with. So you have your pallets, you have your boxes, you have cargo. We ordered the vaccine. It comes to our warehouse where we're tracking temperature and so on. Pardon me, just give me 1 second. I'm sorry, Lindsay, hold on 1 second, please. Sorry about that. More real-time vaccine questions, so my apologies. Okay, so this was our expectation going in, that everything comes in cooling pallets. They're flown from Europe. The vaccine was flown with dry ice from Europe, and then you store them in the warehouse, and then your distributors push them over to the hospital, and then we do what we do best, is administer. And what actually happened was this. So this is our current process. This is the simplest way we could come up with this. This is how you order, receive, and administer a vaccine. And all of this happens in 24 hours. So it's complex, multiple players in the mix, lots of data sharing. You have to have the infrastructure and everything set up, or else this is going to be an extremely manual process. But this is how we play today. I'm not going to go through this. Maybe next time, if you're really interested, we can have another 30-minute session on how to manage this portion here. But, you know, this is what Lindsay and I have to go through every day. And this is just vaccines, not counting all the other businesses and the COVID patients and regular patients and surgeries and MRIs and everything that we have to go through. So me and Lindsay live in this space. How do we get the federal government? How do we contract? We have to purchase it. How do we upload all the data? When is it in transit? How do we coordinate? managing your inventory, storage, remote monitoring, and so on. But a month into this now, it doesn't feel as complex, but I just wanted to let everyone know this is how the process works. Okay, so how does Wellstar work with this process? So vaccine A and B, I could care less, Pfizer, Moderna, we don't endorse a particular one, they're all effective. We are fortunate enough to have a pretty advanced distribution model at Wellstar. So we do have a central distribution process where we actually receive vaccines in, and from there, it's called a pod, it's point of dispense. Should there won't, but me with my military background, I'll also tell you, and I see participants from the DPH today, we, for emergency management purposes, if there was a chemical warfare attack or bioterrorism or something, we go through these drills all the time. So this is normal when it comes to distribution, how pods work, how to receive the inventory, what to do in case of a chem attack, so on and so forth. So vaccine is no different. We kind of handle it the same way. DPH kind of coordinates with us. We go ahead and take the small batches, we put them in our warehouse. From our warehouse, we move them over to the hospital pharmacy areas that go to satellite offices, and then we coordinate with folks based on their schedules and appointments and demand about how much vaccine they're going to need, and coordinate the dry ice process and the freezer process, because once the vaccine is out of the dry ice or the freezer, it's only good for 5 days. So we have to burn the vaccine and not waste any. So that's where perhaps the evening time is spent on. We have 5 doses available, and we have to start opening up schedules and starting to get people in. So just FYI. So this is how the Wellstar process works for the vaccine administration for COVID. And that was actually the end of my presentation. So I know that was a lot of information. I'm sorry if I went into quite a bit of detail. It was just so that you understand. So if you are unable to get onto a schedule, or if you're waiting, what's taking so long? Hopefully I'll be able to give you what your peers and everything are going through at the moment, and how we're trying to open up access. But one last thing though, despite of you getting the vaccine, I can't stress enough of, wear your mask, watch your distance, and wash your hands.
Thank you so much for sharing the information with us. I was saying to Doshi before we started that with all the information that's out there, it's sometimes hard to really discern what is happening even in your own community. And I think that's probably why many of us are on today. And this was obviously a very popular 12 at 12 that is not just 12 people. So Doshi, we have some questions, and I would ask anybody who has interest in asking questions to please put that in the chat box, and I'll try to relay those as best I can. The first question that I have is actually, if you are 65 and over and don't have access to a physician's practice that's offering the vaccine, how do you sign up for an appointment? The Fulton County Department of Health currently has no appointments. Yeah,
so good. That's a good question. So you have a couple of options. One, you don't have to get vaccinated in the county that you're in. And I'm not saying have somebody 65 and older drive to Troup County, but I just wanted to be clear. I live in Alpharetta, so Fulton County. I could go to Cobb County, Douglas County, wherever to get vaccinated. So that's number one. So don't let that hold you back. That's number one. Second, at the moment, if you go onto the DPH's website, it's not Fulton County or Cobb County, the only ones having clinics. There's other medical centers and other clinics that are open that you could get scheduled to. So my wife is a healthcare worker as well in Alpharetta. We have not opened, she's not affiliated with Wellstar, so for that reason, she could not get her vaccine. So we found, through the county, through DPH, we found a medical center in Johns Creek where she could actually get on the schedule and get vaccinated. And when my parents come visit me in a couple of weeks, I will be doing the same for them, as they are also not established patients of a particular primary care, perhaps in our county here. So that's the only access points I have today.
Thank you. And I know there are many people out there who maybe have seniors who have moved in with them through this process, and they're trying to keep them safe, and they may not even be from this state. So it's gotten very interesting in all of this. I have a question about whether or not we're going to need the shot annually, like a flu shot.
I hope not. Data will tell. So there's a couple of things. If everybody gets vaccinated and everybody practices the 3 Ws that I mentioned, then hopefully we can just eradicate this, and then we won't have the need to play. To be honest with you, being in the hospitals, being a pharmacist, and Lindsay will tell you, I don't think I can take a 2021 like this again. Personally, community, work-life balance, we're all just burnt out. And you too in personal lives and stuff as well. And I too have my parents coming with me now because they're notorious of just driving my car all around town. So I kind of sold my car, locked them in my house, and I have now become the parent and trying to protect them. So data will tell us that. Right now, the booster is what we are recommending. There is some data to show, some people antibodies last for a couple of years. If that's the case, then we won't have this annually. Maybe we do it like the tetanus shot, maybe every 5 years. But yet to be seen, to be determined. I hope that's not the case, but we all in the community need to do our part.
Thank you. We've gotten quite a few questions, so I'm going to roll through them, Doshi. I hope you don't mind. And we recognize that you won't maybe be able to answer everything, but we're throwing them out there. So as a medical device company of contact lenses, where would we fall into for associates to be vaccinated?
Ooh, that's a good one. Okay. So there's always going to be these multiple buckets and the gray area kind of thing. What if you're a primary care office that's not affiliated with a hospital? Where do you go? So valid question. Let me look at the buckets again. So today, the way we're looking at that, I would say you would fall under phase 1B. Now, caveat. Okay, so if you're a manufacturing company or what we like to call a vendor partner in my world, so let's say you're supplying us with supplies for our OR, and you have your vendors on site doing, with our surgeons, managing the robotics or the equipment. You know what? We would say you're an essential worker and you need to get vaccinated immediately. And the institutions that you work with will get you vaccinated. So for example, for Wellstar, we have opened up those that have visit our facilities for surgeries or are involved in healthcare of our patients and are considered frontline. We have started vaccinating them as well. So if you worked for Siemens, for example, and you're our OR rep that's supposed to be in the surgery room, we are vaccinating you. But those are, I know it's a workaround though. It's not a clear, you're not going to see that on the schedule open up. You need to work with the healthcare partners or the people that are administering the vaccine and work with them to make sure you get on the schedule. And then before we open up to phase 1B, all institutions are working to make sure whether you're affiliated or not, that you should be able to get the vaccine as a essential worker for us. So that's how it's going to open up today.
Great, thank you. Great presentation. In your opinion, how soon will we be able to go back to not wearing masks after all of the phases have been completed? Doshi, you got your crystal ball out?
That one's going to be tough. I'll tell you, if we don't wear masks, then this, we spend a lot of money on the Wellstar mask. It's some cost for us. No, I make fun because I don't know. It's weird sending my children to school with masks on and telling my 5-year-old to keep it on and not touch her face and stuff. And I think we all want to get back to whatever that normal is going to be. I think for some people that are at risk, I'll tell you that mask normal perhaps is going to remain. I'm not quite sure if, I want my father without a mask around town just because of his underlying medical conditions and stuff. Till we completely eradicate the disease. So for that reason, Lindsay, unless you have something else, we're not, it's hard to tell. We're preparing as if masks are going to be normal for foreseeable future. But like I said, we need to practice the 3 Ws I mentioned, get the vaccine, do our part, so then we can have a conversation next time about, hey, it's okay, masks are optional.
Thank you. Also a question, and again, you know, there are lots of rumors and stuff out there. So this person heard a report yesterday that large hospital systems were hoarding the vaccines and the state was ordering excess vaccines to be returned. Is that true?
So let's answer that in reverse. So I'm a little biased, but I'll be transparent with you. Okay, so let's go in order. The vaccines cannot be returned. I assure you, our peers, Wellstar, Emory's, whoever, I assure you, we will find somebody to vaccinate. If somebody wastes a dose, you know, I think a tear falls from Lindsay's eye every single time. So we minimize that. And I'll tell you, Wellstar has vaccinated close to 11,000 people as of today. I can tell you maybe 3 doses were wasted, perhaps, and those were the extra doses from the vials, okay? So we try our best. There's sophisticating scheduling mechanisms and so on. What has happened, though, is, you know, and I'm impressed that we've actually distributed quite significant number of vaccines. And you've distributed them, but we have not been able to, I can speak for Georgia, not able to open up access. And so for that reason, yes, that is true that we are sitting on vaccine. We have inventory. We just don't have arms or the staff to push the vaccine into. So I wouldn't say hoarding, but I will tell you that with our schedules being full over the next 2 weeks, and when I report out inventory numbers to the state, Wellstar will not have a hoarded supply for sure. But yes, you are right. We're sitting on approximately 7 to 8 days of vaccine, but all the coordination activities that I told you cannot happen with 1 day of vaccine on hand. You need to have 7 days. You need to bulk up so that you can coordinate and push where the vaccine is needed. But you are right. I think the state is doing a great job trying to push the vaccine out now. Our run rate is increasing, and I'll assure you that you know, the media that we've received about hoarding vaccine and Georgia not doing a good job will dissolve in 7 days.
Thank you, Doshi. And I want to make a point, just as the chamber president for the region, that we have so many healthcare partners up here. I mean, Wellstar, obviously, Northside, Emory, Doshi, you mentioned, Children's Healthcare, Kaiser. There are so many partners in that healthcare area, and I'm hearing from all of them. And everyone is doing their best, and everybody is incredibly burned out and exhausted. Doshi, to your point of, you know, can we do this again? Nobody wants to do this again. So, you know, we want everybody to take care of themselves and do those things, but we know everybody's doing their best. And I saw the chart and all the arrows going in every different way. And so trying to discern what is best, I leave in the hands of what I believe are the best healthcare providers in the country. I'm glad I live in North Fulton. This is a good problem to have from that perspective. Okay, sorry, soapbox. Back to my, I understood that the Moderna vaccine was good for 2 years. Is that correct? That was on the timing, how long it would last in your system.
Yeah, okay. So when you say good, if I leave it room temperature, I assure you it's not.
Yeah, no, this was, I think,
yeah, once administered. No, yet to be seen. The data, will tell you that the data is not strong enough to say that it's good for two years. We're still enrolling people in the vaccine studies so that we can track them and track their antibodies. So if we start seeing more of that, I think everyone will have confidence. And that's why in the news, we're also hearing that maybe we hold off on giving second doses and everyone just try to exhaust first dose vaccinations. Because it doesn't have to be that you have to get your second dose on the 30th day or else it's not going to be effective. You can take it past the 30th day, but don't come sooner than the 30th day. So we are struggling with some of that, but the data at the moment is not conclusive that by giving the booster shot, we're good for 2 years. I'm hoping that will be the recommendation, I'm sure, but more to come on that.
Got it. Doshi, just a couple of direct questions. How long after the injection, the vaccine injection, and in this case, obviously the 2, is it effective?
So your body starts building the proteins that trigger the T cells and the antibodies almost immediately. But if you want to build a sufficient response, saying 50%, 60%, 70% protective, it would be around 3 weeks. So 2 to 3 weeks is what I would say. So it's not that you get a vaccine and 3 days later you're 80% effective all automatically. It would take around 2 weeks, 2 to 3 weeks.
And then I have someone asking, is the second dose, which I believe you're referring to as the booster, the same as the first, or is it different?
It's actually the same, right? So it's not a decreased concentration. It's not a traditional booster. It's actually just getting the vaccine again.
Got it. Looking through lots of compliments to Wellstar and what they've done. If you've never tested to determine if you're positive or asymptomatic for COVID, can you still take the vaccine?
Yeah, that's a great question. So there's no prerequisite here of you positive, negative kind of thing. Just take the vaccine. Now, caveat. If you're COVID positive, so today, let's say my dose is scheduled for Saturday, and I tested positive for COVID on Friday. My recommendation would be, and our clinical recommendation, when I say my, as in a group here of an army of physicians and everyone else and smart people like Lindsay, I'll tell you, hold for 30 days and then get your vaccine. So if you have symptoms, or if you have COVID active right now, or if you were on any COVID therapy, specifically antibody infusions and so on and so forth, wait 30 to 90 days before you get your vaccine.
Got it. We have a lot of questions. I'm trying to make sure that I'm not missing any. I apologize.
No.
We had, as a reminder, the 3 W's: wash hands, wear a mask.
Go ahead, Callie, make me proud.
Watch your distance.
Yes, exactly. Perfect. Thank you.
Yes. Well, I'm reading, so yes, the 3
It's
W's.
an open book test. It's an open book test.
Right. So that's good. We remember that. Wonderful. I think I have reached the end, which is perfect. We tried to do our end time, Doshi, at 11:50 so that people who have 12 o'clock Zooms can Zoom in and out as they need to. I want to thank all of our guests today. This has been particularly interesting in light of obviously current circumstances. Doshi, thank you for your informative presentation. I do understand, as you mentioned, this stuff is changing so rapidly that we could do another one of these in 2 weeks and it may look completely different. So we will definitely keep that in mind. I want to especially thank our sponsor, Laura Matajewski and HLB Gross Collins. Laura, you are a great partner. We appreciate your involvement in North Fulton as well as with the Chamber. So thank you very much. Most importantly, we thank all of you for joining us today. The GNFCC Chairman's Circle is an influential part of our chamber, very important to us as we move forward and transform into the chamber of our future. And so we value your partnership. We're glad you were here, and we look forward to many more events with you. Remember your 3 W's, and we'll see you here soon.